The aim of the programme is to improve access for mental health care for people with serious mental illnesses. We've done this by trying to improve access by breaking down some barriers, the inequalities, and also really focusing on some joined-up working with our amazing voluntary community sector partners.
We've been really excited and pleased to be part of this transformation programme because for the first time it provides us an opportunity to be really joined up with the NHS and other statutory services to support individuals with serious mental health, and to work more closely together and to collaborate is a great opportunity, not just for our organisation and the organisations we represent, but more importantly for the people in Gloucestershire that we serve.
It's been really important to co-produce this piece of work. The changes that we're hoping to do are for our service users, so having our Experts by Experience's voice at the heart of all the change we do really helps us know that we're driving towards improving things for them.
I think it's quite vital for Experts by Experience to be involved because they're the ones that have the most knowledge about where the system flaws and where the system works.
I think it's incredibly important for Experts by Experience to be involved because by the very nature of the title we've got experience in mental health. We've got lived experience.
We actively involve our carers in any process. We send out regular emails and information so they can get involved in this co-production of the changes for the community mental health transformation, because it is important to hear from those experts and those carers about what is important to them and how they can make changes in their life and make positive changes in their life.
The value of co-production is to provide a quality service within the NHS so that anybody who has need of any of the services within the NHS, whether it be mental or physical, then they have a good quality of service whereby their needs are being listened to and heard, and it's very much a person-centred approach now towards the individual.
They come to our regularly weekly meetings, our implementation meetings, and have really helped us to stay on track, making sure that we don't forget who's at the heart of the change we're doing.
So it's important for the service to be for the people, because we are the people that are going through the different situations. We know how we have felt and we know what has been helpful for us and what hasn't been so helpful. So it's important that Experts by Experience have that clear view and are able to inform future practice.
We did a workshop with our experts and showed them their options. They really liked dialogue, and they've helped us to create training that's now being delivered across the Trust and also the BCSC partners.
So we've met with professionals and advised on things like language, the way they use acronyms, jargon, and we've said, no, don't do that. That's really not very helpful.
I feel as if in the stakeholder events, the most important people in that room is the Experts by Experience, and I know that that's, everybody in that room is equally important, but it feels as if all of these professionals have all come together in one room to genuinely take the advice or word from people like myself to make things better. So I feel most validated in those stakeholder meetings because what we say is so important to them.
So it's enabled me to increase my confidence and enabled me to support others, and has enabled me to really identify what services are out there and what needs to change.
I think being involved in this project as an Expert by Experience has made a huge difference to me. Historically, for many years, I have been disempowered by the system. I have been made to feel that I wasn't very important, and what I needed and what I wanted didn't matter. So being involved in this project and helping to shape the system and make it better for future users has been hugely beneficial, and I hope I am helping to make it better for people in the future. The benefit of this is to take, hopefully, the service back to being about the service user and what's important for them and what they need, rather than it being what the professionals think the service user needs.
I think one of the key benefits that we've experienced is having a real clear bridge between our service users and the people delivering the service. Having our experts by experience has really helped us to stay grounded and ensuring that we're doing these changes with people as opposed to people.
Their voice is absolutely key. They are the people that have experienced services in the past. They know what they need and they know what others like them need. So they are actually the people that can provide and guide the future and help us all provide a much better service for everybody living in Gloucestershire with serious mental illness.
Being part of a co-production is very important to me because having had the lived experience in the past and gone through my own personal journey, I am able to then pass on the message that this is how it worked for me and how I progressed to the point that I am now.
We're so grateful to the Experts by Experience for sharing their views and opening up to us in what they've gone through in their experiences. Their voices and their stories have really helped us to shape the future of the MHT project.
I spent all those years saying there's going to be a day where I'm going to do something, I'm going to make it better, I'm going to try and do something to stop people like me struggling for so long. And then I came across this job position and I got the job, and I still can't believe that I'm actually able to say that I'm part of a transformation team making changes to the mental health system, because it still doesn't feel real to me.